It gets a bit repetitive, banging on about the pandemic and the way this country has overreacted. Almost every night for a year now, I've given you data, shared research, provided examples, compared countries and states, and relentlessly interviewed doctors, scientists, economists, politicians and others about the coronavirus and our response. But the bottom line is that it is the absurdity of it all, the silliness of it all, that really brings home the reality. I mean, much of what we're seeing is beyond satire. The scriptwriters at Utopia or Yes Minister just wouldn't try this stuff. It's too absurd. Have a look at this. This is people being shifted out of hotel quarantine in Melbourne today. This is the state that says it has a gold standard pandemic response and quarantine system and has all the best equipment a year into the challenge. And they are sticking garbage bags on people's heads, garbage bags, and taking them out to the bus, supposedly to hide their identity or whatever. Remember, the Victorian Premier said yesterday that the virus is getting smarter. It's a pity we can't say the same for the Victorian health system. Think about this. This is Mildura. It's a 6 hours drive from Melbourne in the Sunraysia district, semi-arid on the Murray River. It's over 30 degrees there today. And the 30 to 40,000 people in that area have not seen a coronavirus case for almost 6 months. Yet they're locked at home and they must wear masks inside and out. No school, many businesses shut. There's no COVID in Mildura. The only cases are 550 kilometres away, connected to hotel quarantine in Melbourne. How do you explain this insanity? Across the river from Mildura is Bureaucrats, effectively a suburb of the same town, but it's a New South Wales town. No masks there, no lockdowns, schools open, all the rest of it. And think about this. Remember we used to talk about protecting our children from debt? How Labor's reckless overreaction to the global financial crisis put our budget $50 billion into deficit and pushed our government debt up beyond $300 billion? Now we don't care. Just to get through 1 year of COVID, just to send everyone home and pretend we can eradicate a virus that will be with us for years and decades to come, we've plunged our budget into a $200 billion deficit. And we're going to give our kids a $1 trillion debt, $1,000 billion debt to pay off. Without even thinking about it, without even a debate. This is not rational. There has been no sensible cost-benefit analysis or debate here. All of this for a disease which is almost completely harmless to children and young people, only a mild concern for healthy adults, and only a real health risk to the very elderly or the very ill. All the medical advice is that kids are best off at school, yet they were kept home from school for much of last year in many states, and again at the start of this year. Why? Because of fear, ignorance, union demands, or political theatre. Yet in order to protect the very old from infections that could shorten their lives, the way that the flu, the common cold and pneumonia can do every winter, we have for long periods locked them down in aged care facilities, cutting them off from their family and friends, their social contacts, the main reason for which their life is still worth living. The paradoxes are everywhere, the silliness. Tennis is fine for the professionals in Melbourne Park, but it's unsafe for country players at Swan Hill. Sydney can control outbreaks while most of the state carries on as normal, but Melbourne locks down like Pyongyang. Perth and Brisbane lock down millions of people because one person is infected and no one else catches it, not even their partners. And this is the virus Daniel Andrews calls smarter, faster and more infectious. All the while, the one thing they don't tell you about most of these detected infections is that the patients don't get sick. One of the people in the latest Melbourne outbreak, a chronic asthmatic, has been very ill. Let's hope he keeps pulling through. But most of the cases have been asymptomatic or mild. Remember the Sydney Morning Herald headline last year about how a supposed new strain of the virus in South Australia was super dangerous because it produced no symptoms? Imagine that, a disease so horrible it doesn't make you sick. This sort of illogical nonsense has become commonplace. Daniel Andrews, who has presided over incompetence, tragedy, overreaction and obfuscation when it comes to accountability, is nominated for an annual political prize. Now, I've known about this for a while because I'm on the judging panel. You know what I'll be saying in the meeting. But seriously, who could propose this stuff? In New York, the governor, Andrew Cuomo, who, as we told you last year, ordered COVID-infected patients back into nursing homes, was lauded by most of the media all of last year as a pandemic hero. Only now is he facing a political reckoning over those decisions and hiding the facts. State premiers who know there will always be a chance of the odd infection escaping from hotel quarantine want to shift the whole operations now out of town. Daniel Andrews wants to do it out at Avalon Airport, which, going by their past behaviour, means entire regional communities will be cut off once there's an infection. They'll impose localised lockdowns and the quarantine will cease. It's all nutty. All this worked in New South Wales. New South Wales has processed 130,000 people through hotel quarantine in the city. It just doesn't make sense. As I kept saying last year, they are treating this virus, some of these politicians and bureaucrats, like it's Ebola, when it's far from it. Your child is at much greater risk from the flu, of course, than COVID-19. Yet every flu season you send your children to school and you keep going to work. Most people don't even get the annual flu jab. People in this country are wearing masks while they shop and then they're going outside and smoking cigarettes. Or there have been cases where they've been seen wearing masks while riding a bike without wearing a helmet. Or missing regular health checkups because they're worried about catching coronavirus at the surgery. There are lots of risks in life. You want to weigh them up with some proportionality. Our response is silly and out of proportion, over the top and irrational. It's fuelled by an alarmist media and politicians who love scaring people in order to be their saviours. Some countries have real problems with this virus because they've let it run amok, but even they are sometimes more realistic about the threat and how to deal with it. Don't think the vaccine will fix all this. There will still be COVID-19. I'm not looking forward to more craziness later this year when we have half of this country vaccinated, certainly everybody who's vulnerable, and Melbourne is still locking down because a handful of cases pop up in hotel quarantine. Anything is possible when you see the absolute inanity of Melbourne being in lockdown now, 5 million people, plus 6.5 million really across the whole state, in lockdown now over a couple of cases a day.